Good morning or good afternoon to all. I'm going to present our study entitled Association between Toileting Behaviors and Urinary Incontinence Symptoms among Young Women. I have nothing to disclose. Urinary incontinence is a multifactorial condition. Established risk factors have been identified by several research studies. In recent years, association between toileting behaviors and lower urinary tract symptoms have been investigated. However, little is known regarding the potential relation between women's toileting behaviors and bladder health. Therefore, the aim of our study was to investigate the association of self-reported toileting behavior, lifestyle habits, and health conditions with symptoms of stress and urgency urinary incontinence among young women. We conducted a cross-sectional study in a sample of 669 young, nulliparous, and healthy women. Data on sociodemographic and anthropometrics, lifestyle habits like smoking, alcohol consumption, and type of exercise practice, medical history as constipation, urinary infection, and family history of UI, and toileting behavior were collected by questionnaire. Questions for toileting behaviors include voiding posture, premature voiding, empty the bladder completely, delayed voiding, and micturition frequency. The ICIQ was applied to assess urinary incontinence symptoms, namely stress and urgency urinary incontinence. Based on the ICIQ, about a fifth reported urinary incontinence symptoms. Regarding the comparison between continent and women with UI, significant differences were found in lifestyle-related variables. Continent women reported more smoking habits and more frequency of alcohol beverage consumption. More incontinent women practice high-impact sports. In respect to urinary habits, significant difference was found on frequency of urination. Continent women reporting fewer micturition per day. No difference were found in the other considered urinary habits. Regarding the analysis of the association between toileting behaviors and symptoms of UI, adjusted for confounding variables, the most consistent association was found between delayed voiding, many times, always, with both symptoms of stress and urgency incontinence. Also, not sit on the toilet seat for voiding, sometimes, was associated with urgency urinary incontinence symptoms, and fewer micturition per day, less than 4, was associated with lower odds of stress urinary incontinence. Our take-home message: unhealthy daily micturition habits can have a negative impact on lower urinary tract function in women. However, the relationship between toileting behaviors and specific lower urinary tract symptoms is still unclear. The education about healthy micturition habits from healthcare professionals, particularly in community setting interventions, could have a positive impact on the development of lower urinary tract symptoms. However, our results should be read with caution, and prospective studies are needed. Little is known about the short or the long-term effects of those toilet behaviors on bladder function. Also, determinants of toileting behaviors should be explored. If toileting behaviors are associated with urinary incontinence, preventive strategies could be implemented while women are still young. Thank you for listening.